Hi friends, good evening. Once again, welcome back to my channel Mukambika Nursing. Friends, here we are discussing important and previous year questions for nursing officer exam preparation. Already we completed 8 special MCQ part. If you are watching first time, kindly go through my previous videos. Surely these questions and answers will helpful for your exam preparation. If it is useful for your studies, please share my videos to your friend circle. Also subscribe my channel and support me. Let's see today's question. Our first question. Which of the following joint is seen between the carpal and metacarpal bones of thumb? Options. Option A, ball and socket. Option B, pivot joint. Option C, hinge joint. Option D, saddle joint. Our question is, which joint is seen between the carpal and metacarpal bones of thumb? And the correct answer is, it is saddle joint. Option C, D is the correct answer. Move on to the next question. The test used for the diagnosis of trichomoniasis is? Our options. Option A, weight mount of vaginal fluid. Option B, specific serologic test. Option C, ova and parasite fecal smear. Option D, none of these. Here our question is, the test which is used for the diagnosis of trichomoniasis is. We can see what is trichomoniasis. Trichomoniasis is a sexually transmitted disease caused by a parasite. Its name is Trichomonas vaginalis. A vaginal weight mount, or sometimes called a vaginal smear, is a test to find out the cause of vaginitis or inflammation of the vagina and the area around the vagina, including vulval area. So the test which is used for diagnosis of trichomoniasis is weight mount of vaginal fluid. Option A is the correct answer. Move on to the next question. Which one of the following is not a chemical disinfectant? Options. Option A, glutaraldehyde. Option B, Lysol. Option C, isopropyl alcohol. Option D, ethylene oxide. Here the question is, which one is not included in chemical disinfectant? And the correct answer is, it is ethylene oxide. Ethylene oxide is in the form of gaseous state. Remaining all are chemical disinfectant. Glutaraldehyde, Lysol, isopropyl alcohol. Okay. Here the correct answer is option D, ethylene oxide. And the next question is, food intoxication due to canned foods are caused by? Options. Option A, staphylococcus. Option B, Clostridium botulinum. Option C, streptococcus. Option D, salmonella. Here the question is, food intoxication, that is toxification of food due to canned foods, are caused by Clostridium botulinum. Option B is the correct answer. Move on to the next question. Sharp instrument should not be sterilized by? Options. Option A, autoclaving. Option B, boiling. Option C, hot air oven. Option D, antiseptic solution. And the correct answer is, it is by boiling. Option B is the correct answer. We will not sterilize the sharp instrument by boiling because the instrument will blend. Okay. And the next question is, boiling of water helps in killing all of the following organisms except? Options. Option A, fungi. Option B, spores. Option C, protozoa. Option D, bacteria. Our question is, by boiling of water it will help to kill the organism except one which is not killed by boiling of water. It is spores. Option B is the correct answer. Move on to the next question is, fetus develops its own blood supply from which weeks of gestation? Options. Option A, 10 to 12th week. Option B, 12th to 14th week. Option C, 12th to 16th week. Option D, 12th to 20th week. Our question is, from which week onwards the fetus develops its own blood supply? Okay, it's by 12th to 20th week of gestation. Option D is the correct answer. Move on to the next question. The heart is developed from? Options. Option A, paraxial mesoderm. Option B, plangnopleuric intraembryonic mesoderm. Option C, intermediate mesoderm. Option D, somatopleuric intraembryonic mesoderm. During the embryonic period, the heart is developed from plangnopleuric intraembryonic mesoderm. The correct answer is option B. During the embryonic period, the cardiovascular system, pericardial, pleural and peritoneal cavity, then cartilage, muscles, bone, gonads, spleen, genital tract, most of these organs are developed from mesodermal layers. Here specifically they given which layer of mesoderm. So the correct answer is option B. Move on to the next question. Fetal pancreas secrete insulin at which week of gestation? Options: option A 8th week, option B 10th week, option C 12th week, option D 16th week. So the fetal pancreas secrete insulin at 12th week of gestation. Option C is the correct answer. Move on to the next question. A child's heredity is determined at the time of options: option A viability, option B conception, option C delivery, option D infancy. Child's heredity is determined at the time of conception itself. So the correct answer is option B. Move on to the next question. Small intestine develops from options: option A foregut, option B midgut, option C hindgut, option D urogenital sinus. And the small intestine which is developed from midgut, option B is the correct answer. Move on to the next question. Oxygen and carbon dioxide are exchanged in the placenta through the process of options: option A penocytosis, option B facilitated diffusion, option C diffusion, option D active transport. Oxygen and carbon dioxide are exchanged in the placenta through the process of diffusion. Option C is the correct answer. And the next question is, normal weight of placenta at term is options: option A 1/4 of baby weight, option B 500 gram, option C 900 gram, option D 1/6 of baby weight. Question is, normal weight of placenta that correspond to the proportion of the weight of the baby is about 1/6 of baby weight. Option D is the correct answer, or the proportion is 1:6. And the next question is, the outermost membrane of the placenta is options: option A chorion, option B amnion, option C cotyledon, option D yolk sac. The outermost membrane of placenta is chorion. Option A is the correct answer. And the next question is, human placenta fully develops at which month of pregnancy? Options: option A first month, option D second month, option C third month, option D fourth month. Human placenta fully develops at third month of pregnancy. Option C is the correct answer. And the next question is, signs of Guillain-Barré syndrome include options: option A weakness, option B muscular rigidity, option C diplopia, option D tremors. Guillain-Barré syndrome is an acute infectious neuritis of the cranial and peripheral nerves. Symptoms gradually affect the upper respiratory tract. Also, it may affect the gastrointestinal system, that is gastroenteritis. And its signs and symptoms include paresthesia, then pain, weakness of the lower extremity, also gradually weakness of the upper extremities, and also facial muscles, weakness of the facial muscles. There may be chance of respiratory failure. So here the correct answer is weakness. Weakness means weakness of the lower extremities, also upper extremities and facial muscles. So the correct answer is weakness. And the next question is, postoperatively urine sample to be sent for options: option A pus cells, option B protein, option C sugar, option D albumin. During postoperative period, the urine sample will be sent for checking pus cells. There may be infection in the urine. So in order to find out that, we are collecting postoperatively urine. So the correct answer is option A. And the next question is, earliest sign of myasthenia gravis is options: option A ptosis, option B ascending weakness, option C diplopia, option D presbycusis. Myasthenia gravis is a neuromuscular disorder mainly due to defect in the transmission of nerve impulses at the myoneural junction, and it is mainly due to insufficiency of secretion of acetylcholine. Okay. And its signs and symptoms include difficulty in chewing, ptosis, dysphagia, diplopia, weakness, hoarse of voice, difficulty in breathing. Here our question is, earliest sign of myasthenia gravis is ptosis or drooping of the eyelid. Option A is the correct answer. And the next question is, what is often the first symptom of Parkinson's disease? Options: option A headache, option B nausea, option C shaking of hands or foot, option D turning of head. Parkinson's disease is also a degenerative disease which is caused by the deficiency of dopamine. The first symptom which is often seen in Parkinson's disease is shaking of the hand or foot. Option C is the correct answer. And the next question is, drug of choice for trigeminal neuralgia is options. Option A lorazepam, option B carbamazepine, option C naproxen, option D morphine. Which is the drug of choice for trigeminal neuralgia? It is carbamazepine. Option B is the correct answer. Trigeminal neuralgia is a sensory disorder of the trigeminal nerve, that is fifth cranial nerve. And the next question is, what is the minimum contact period for sterilization of ambu bag with 2% glutaraldehyde? Options. Option A 6 hours, option B 12 hours, option C 24 hours, option D 48 hours. Our question is, for sterilization of ambu bag with 2% glutaraldehyde, what is the minimum contact period? Okay, it is about 6 hours. Option A is the correct answer. Here we discussed important and previous year questions, and we will continue the questions on coming videos.